You are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okwan. Yes, we are still in the era of anatomy of clinical importance. And my friends, this is today's case study. A 52-year-old woman having breast cancer relating to the left side of her body that originated in the upper lateral quadrant of her breast tissue underwent an uneventful and a successful mastectomy involving axillary lymph node dissection upon the advice by the clinician. Now, weeks after the surgery, she began noticing gradual swelling of her left upper limb, especially at the level of the arm, and physical examination revealed that of the left upper limb, the circumference of the arm, had increased about 3 centimeters more than that of the right upper limb. Now, this is the case study we have before us, and we have some questions to go through. Now, the first question for us is that what is the most likely diagnosis as far as the post-surgical swelling of her left upper limb is concerned? And my friends, your answer is lymphedema. Now, the next question for us is that what is the basis for this lymphedema? Yes, the main thing is because of the radical dissection of the lymph nodes relating to the axilla, and therefore drainage of the left upper limb wasn't effective, leading to buildup of fluid, causing this kind of edematous upper limb. Now, the next question for us is that why is it that most of the breast cancers originate in the upper lateral quadrant of the breast tissue? My friends, the answer is simple, because about 75% of the lymphatic drainage of the breast tissue goes through the upper lateral quadrant of the breast tissue. Now, the next question for us is that why is it that if you have one breast getting affected by breast cancer, it could affect the other one? And my friends, your answer is that the left and right breast communicate via some lymphatics, which are located at the level of the parasternal region, which we call them parasternal group of lymph nodes, or you can also call them the internal thoracic group of lymph nodes, or internal mammary group of lymph nodes. They communicate. That's the level where we see about 20% of the lymphatic drainage of the breast gets into. Now, the next question for us is that what are the other possible means for lymphatic drainage? Yes, my friends, already about the breast, by way of 20% get into the parasternal group of lymph nodes, 5% may go to the level of what we call the subdiaphragmatic and eventually to the subperitoneal lymphatic plexus. And my friends, what we understand is that the breast tissue, first of all, will be collected in this lymphatic plexus, which we call the subareolar plexus, lymphatic plexus. Yes, subareolar lymphatic plexus of SAPI. Yeah, that's where they will get collected. And then eventually, if it has to go to, of course, downwards, it will go into the diaphragmatic and eventually to the subperitoneal. That's about 5% of lymphatic fluid of the breast going there. And we said already that 25% from the subareolar lymphatic plexus of SAPI, it will go into the parasternal group of lymph nodes. Now, majority, and that's the basis for this question, that we see about 60% of the breast tissue getting affected with breast cancer at the level of the upper lateral quadrant. And the reason is simple, because majority of the fluid, that's about 75%, is draining into the axillary group of lymph nodes, okay, which is related to the left upper quadrant, sorry, actually the upper lateral quadrant. And the pathway of the flow is that from the areolar lymphatic plexus of SAPI, the lymphatic drainage may go into either the anterior group of lymph nodes related to, of course, the pectoralis major muscle. Yes, may go into what we call the posterior group of lymph nodes, okay, which of course we understand related to, of course, the scapular area. Then, of course, may also be related to the upper lateral aspects, okay, of the thoracic wall, okay, related to the humerus, okay, that's the lateral group of lymph nodes. But all these guys will drain into what we call the central group of lymph nodes. And then from central, we go to apical group of lymph nodes. Then from apical group of lymph nodes, we go to what we call the infraclavicular group of lymph nodes, and then into supraclavicular group of lymph nodes. From there, into what we call, in the case of the left, it will go into what we call the lymphatic duct. But in the case of the right breast, it will go into the right lymphatic duct. Okay, so this is the general basis, okay, for all these things we're talking about. But one thing you should understand is that this lymphedema, yes, could be due to blocked lymphatic vessels as well. Yes, it could lead to all these things, and especially if someone presents with some kind of elephantiasis, for instance, it could be due, okay, to the person may have lymphedema of the upper limb also, okay, it may be due to blockage of what we call the lymphatic duct by the pathogen. My friends, this will be the initial portion as far as this presentation is concerned. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.